Welcome to this news. Florida health officials have reported 2 more locally acquired cases of malaria, bringing the total number of cases in the state to 6, and 7 in the United States since May. All but 1 case have been in Sarasota County, Florida, with the other case linked to a Texas man working for the National Guard along the Rio Grande. The Centers for Disease Control and Prevention, CDC, issued a health alert on June 26, asking hospitals to look out for patients with malaria symptoms and be prepared to diagnose them, and start administering antimalarial drugs within 24 hours. Malaria, a serious and sometimes fatal disease, is usually transmitted by mosquitoes, which transfer a parasite to humans through bites. Typical symptoms include fever, chills, headache, muscle aches, and fatigue, with some patients also experiencing nausea, vomiting, and diarrhea. Symptoms typically appear 10 to 4 weeks after being bit by a mosquito. According to Dr. Manuel Gordillo, an infectious disease specialist at Sarasota Memorial Hospital, his hospital has treated 4 of Florida's malaria cases this year. A couple of the patients were homeless and arrived with fevers and dehydration. He also mentioned that some patients neglected their symptoms and presented late with other complications. Public health experts suggest that these cases of malaria may not be cause for widespread panic, but rather a wake-up call for public health workers. The rise in local mosquito populations has been attributed to factors such as climate change and rising temperatures, urbanization, and diminishing residual levels of the insecticide DDT. These are the first instances of locally acquired malaria cases within the United States since 2003. Before the COVID-19 pandemic, around 2,000 cases of malaria were diagnosed annually in the U.S., mostly among travelers and immigrants from regions where malaria is prevalent. It is important to maintain high levels of surveillance to prevent the spread of malaria. Despite this, it should be noted that this situation is not considered a cause for public panic, but it does serve as a reminder to maintain vigilance in monitoring and treating potential cases. Thank you for watching Daily Hot News, powered by AI. For a comprehensive news view, check the links in the description for further resources. If you found this informative, hit subscribe and like. Stay tuned for our next news update.